Hi everyone, Dr. Devin Barley here with Greenwich Bay Chiropractic, and in this video series we're talking a lot about arthritis, more specifically osteoarthritis. This is the most common form of arthritis because there isn't a gene or an illness related to this disease. It's lifestyle factors that affect it. Things like weight, nutrition, carrying excessive loads, what you do for work. All of these things happen, and especially in the spine, because the body is smart, and what it does is it says, I'm feeling increased pressure, load, wear and tear, resistance, and so I'm going to crowd, I'm going to bulk up bone around the joints to create the stability that I'm so craving. This animation is going to show what happens in your low back as we age and the arthritis process forms over time. And so what we can see here, we're looking at a low back, is we can see what happens to the discs, the cushions in the spine, right? They start to compress down. That will crowd the nerves. And over time, what can even happen is something called stenosis, which is basically a crowding of the nerves that exit out of the spine. And that can cause things like back pain, stiffness, leg weakness, numbness and tingling, all of the above. Basically, wherever the nerves go, if arthritis, things like bone spurring, additional bone is pushing on the nerves, then we can have a whole host of symptoms that keep us from doing the things that we want to do. So we want to make sure that we mitigate this as humanly possible, as much as humanly possible, because over time, this is a process that develops. It's called degenerative disc disease in arthritis. And when we talk about that process, we want to do everything that we can in terms of healthcare, nutrition, and mobilization to be able to at least stave the process off or improve it over time. This is just the start of a larger umbrella of things like arthritis, things that we treat here in the office. Thank you so much for listening. We'll see you on the next video.